Hi, my name's Laura Tucker and I'm currently in my third year of nursing. Today in this presentation we will discuss the components and purpose of valid consent in surgical procedures, as well as the role of the nurse in advocating for the patient who doesn't have informed consent in the preoperative phase of patient care. The key to valid informed consent is adhering to the idea that patient autonomy and self-determination is vital in ensuring safe and quality outcomes for the patient. Components of discussion that are important to obtaining informed consent are: the patient must be suitably informed. For a patient to be appropriately informed, it involves using an evidence-based approach to educating the patient in an appropriate manner. A study by Hansen explored the idea that evidence-based practice is a decision-making process where physicians review and then consider what research is essential in educating the patient to make their own decisions. In relation to valid and informed consent, this is empirical in terms of the patient being able to make an educated decision and in turn give consent for the procedure they are needing. Areas and elements that patients must be informed in are the nature of the procedure, what will actually happen under anaesthesia, alternatives to the proposed surgical intervention, as well as the risks of the procedure and then the benefits of the procedure if it is successful. Consent must be given voluntarily, so health professionals informing the patient and in discussing options shouldn't show bias or judgment towards the patient. Patient must have the capacity to give consent, as well as ensuring the patient is understood using cues from the patient such as facial expressions and questions they are asking back to ensure and show reassurance that the patient is understanding information given. Advocating for the patient who hasn't got a consent form. When you think about the nurse's role in terms of caring for a patient, as well as being a medical carer, we provide a holistic approach when it comes to care. We think about their social well-being, mental, physical well-being, and encourage and empower patients to be in charge of their own health. Therefore, if the patient doesn't have a consent form, it's in the best interest and the role of the nurse to inform the surgeon of this missing aspect as soon as possible. It is the surgeon or health provider's legal responsibility to ensure the patient is informed and ready to have this surgery with appropriate documentation shown and filled in. The nurse will continue to advocate for the patient until they believe they are sufficiently educated and a form is completed. The nurse's role is to be witness to the patient signing the form after informed consent is obtained and agreement is made. It's not until this has occurred that surgery can go ahead. Thank you for listening.